there are now confirmed instances of human-to-human transmission.
There's no question that China's bold approach
这个疾病的传染性还是蛮高的。
疫苗的充分的注射。
上楼做核酸。
以最小的社会成本，获得最大的防护成效。
Hello and welcome to our special program on China's decisions during the COVID-19 pandemic in the past 3 years. I'm Li Qiuyuan in Beijing. China's success in battling the coronavirus from 2020 to 2023 was shaped by several key policies. The main threat of the virus is now past, but some prevention and control measures are still in place. And joining us to provide insights are Mr. Einar Tangen, independent political and economic affairs commentator, and Dr. Alice Tan, internist at Ms. Medi Hospital in Seoul, South Korea. Thank you so much for joining us. Now, China has resumed issuing visas, a significant step towards a return to normalcy from the COVID-19 pandemic. In 2020, China made a swift decision to lock down Wuhan, where the COVID cases in the country were first reported. The lockdown helped slow the spread of the virus in the early stages of the pandemic.
3 years ago, Wuhan was the first in China to take on the invisible killer. To contain the virus and to save lives, China made a swift but tough decision to protect its people. On January 23rd, Wuhan went into a lockdown ahead of the Lunar New Year. Citywide public transport was suspended. The city's airports, highways, and waterways were also closed, in an effort to stop the lethal virus from further spreading across the country.
We have to strictly control the sources of infection, the infected and those who come in contact with them.
So, Dr. Tan, let me first get your take on the Wuhan lockdown. That was the first major decision in China's COVID response. It took so much heat back then. Now, 3 years after it, looking back, do you think that Beijing made the right choice?
I think in hindsight, it was perhaps inevitable that that was a step that needed to be taken. If we look at the timeline of what happened, we had the first cluster identified December 21st, 2019, and within 6 weeks or 4 weeks about, suspected cases, confirmed cases went up to about 4,000. And so when you have that kind of elevation and you don't know what you're dealing with, you have to take very rapid and dramatic measures to protect your healthcare systems from becoming overwhelmed. And as they noted in the beginning, there was evidence of human-to-human transmission, that this was a new coronavirus of respiratory transmission routes. And so a lockdown was almost inevitable, I would say, in those beginning stages.
Einar, what do you think? Do you think there could be other approaches instead of a lockdown?
No, not really. When you have a pandemic, it's about transmission and you have to control it. Especially when you don't know exactly what you're dealing with. China acted very swiftly. They did what was necessary, as you heard from the doctor. These are things where science has to rule, not politics. So right now you have a lot of questioning by politicians, but if you look at the main body of experts in this field, there's no question that China did the right thing.
Painful as it is for many of us, it did work to control the virus in that initial stage. Now on to the second stage, when the contagious Delta virus began to dominate mutation in the world. China made a decision to introduce the dynamic zero COVID policy, and that policy aimed to contain the virus in the shortest possible time at the lowest social cost to protect lives. Take a look.
Among the variants, Delta posed the biggest threat. First found in India in October 2020, it spread to over 100 countries in less than a year, according to the WHO. In July of 2021, a cluster of Delta cases were also detected in China. To contain this highly transmissible variant, Chinese authorities quickly adjusted their response measures. In August of 2021, the dynamic zero COVID policy was introduced, with saving lives as the highest priority. Under this strategy, swift actions were taken in a more targeted way after outbreaks were detected. They included mass testing and early treatment. Apart from these, 3 risk levels were assigned to different areas, and COVID management was carried out accordingly.
So now on to the dynamic zero COVID policy. I know you've lived through it during your stay here in China. Do you think they made the right call?
Yes, I mean, there's a lot of, afterthought, and everyone likes to be, as they say, an armchair quarterback looking at the past. But China did what was necessary to protect its people. I mean, if you start looking at the rest of the world and the statistics, right, it's very clear that China did the right thing, despite all the noise that you hear coming from governments who didn't do the right thing, trying to question whether China did.
How effectively do you think this worked, Dr. Tan?
Well, I think, it worked region by region, right, in terms of where the outbreaks were occurring. And in places that were deemed safe, life was relatively normal for huge portions of the population. And so it was really, as you say, a dynamic policy based on risk levels, vulnerabilities, and whether or not it was safe to keep society open by region. And I think this targeted approach made sense. In hindsight, we can say that. One comment that I would like to make, though, is perhaps in terms of the timing, because in terms of the introduction of vaccines, that happened, relatively early after the first year of the pandemic, and yet dynamic COVID-0 did go on was prolonged, and so perhaps in terms of timing, next time we can reevaluate policies.
And Dr. Tan, you once mentioned that one of the advantages of the dynamic zero COVID policy is that you may have fewer cases of long COVID. Tell us more about it.
Right, absolutely. So one of the strategies for preventing long COVID is to prevent, of course, getting COVID in the first place. And so if you have a dynamic COVID-19 policy where you are limiting exposure and transmission, then of course your chances of getting infected are lower, and then your chances of long COVID are also diminished.
All right, stay with us. China's decisions on lockdowns and the zero COVID policy were not exceptions. In Italy, a nationwide lockdown was imposed on March 9th, 2020. About a week later, France declared a nearly 2-month nationwide lockdown. The move was followed by New Zealand, Australia, the UK, and some Western countries. And New Zealand also took similar measures as China's dynamic zero COVID policy, but it escaped the kind of criticism directed at China. And here is Professor Joseph Gregory Mahoney on it.
A zero COVID policy, a similar zero COVID policy in New Zealand. And New Zealand's a member of the Five Eyes. We didn't hear the United States ranting about that. So there's something of a double standard. China's dynamic COVID zero created the closed loop manufacturing. It protected workers, and it provided a lot of the goods that were necessary for people to survive.
So, Dr. Tan, like we just heard there, a number of countries have imposed a lockdown. China was not the only one who has done it, and some of it are quite aggressive, like the ones we've seen in New Zealand. They're not being called draconian. They've been being praised for having one of the best COVID responses in the world. Why is that?
Well, I was actually in New Zealand during lockdown in that country, so I felt exactly what happened. And I think what happened in New Zealand is they had the advantage of time compared to China, right? They went into lockdown in April, and so for an entire month, they could look and see what was going on in other countries, and they could prepare and be a little bit more organized in terms of their lockdown. It is true that it was not as draconian. In other words, we could go out for a walk 1 hour a day. The supermarkets were open. We can go to the supermarket to get our groceries. And so there were differences in terms of how it was carried out. I think, though, when we look at the mortality data, outcomes of the COVID-19 pandemic, however, if we look at New Zealand, it does have one of the lowest death rates per population. And so to some degree, lockdowns are necessary. And the purpose is to prevent collapse of the healthcare system. And so, in the beginning, when you have a lot of uncertainty and you don't have countermeasures in place, this is all pre-vaccine, right? Sometimes you have to take these measures that are they're harsh, but they can be managed in ways that are perhaps less draconian.
Einar, what do you think? Are those criticisms directed at China fair?
No, of course not. It's politics. Listen, you look at the United States, they have 4.2% of the world's population, 16% of reported deaths, and that's not going into what will become important, and that is this issue of excess deaths. This is going to be the way. So, 6 months, 8 months from now, when people are starting to look at this entire period and they start looking at excess deaths, it's very clear that China is going to come out on top in terms of percentages for a country of its size. I mean, New Zealand, China, slight difference in terms of population and the kind of logistics that are necessary to do that. So, I mean, this is one of the greatest fears that is out there, that somehow China has, in fact, done the best job of containing the virus, of saving lives, and at the same time, growing its economy. And as I said, for a place like the United States, they're very concerned about appearing the best. They want to say we have the best system, but they have not delivered the best results.
All right, you're now watching our special coverage, China's COVID decisions. Stay with us. We'll be right back.
There are now confirmed instances of human-to-human transmission.
There's no question that China's bold approach
这个疾病的传染性还是蛮高的。
疫苗的充分的注射，
上楼做核酸，
以最小的社会成本获得最大的防控成效。
Welcome back to our special coverage, China's COVID decisions. Throughout China's COVID response, President Xi Jinping stressed the need to protect lives.
On the first day of the Lunar New Year in 2020, Chinese President Xi Jinping chaired a meeting of the Standing Committee of the Political Bureau of the CPC Central Committee. He stressed that the country's top priority was to save people's lives, and the most important task was epidemic prevention and control. Beijing had made it clear that while balancing pandemic control and economic growth, safeguarding people's lives and health was at the core of China's COVID response.
We must put people and their lives above all else. The battle against COVID-19 is won for people and by people.
Einar, let me get your take on the principle of putting people and life first mentioned by the president. How is that embodied in China's COVID response? Why is it so important when battling a pandemic like this?
Well, I mean, if the government is supposed to be working for the people and it's not trying to save your life and provide a safe environment, what use is it? And I would go to one simple statistic. If you haven't seen it, take a look at the Edelman Trust Index of 2023. China is at the very top in terms of trust of the government and very, very highly placed in terms of trust in their businesses. You start looking at the countries that are most vocal about how China has failed its people, it's the ones that have actually done it. So, as I said, a lot of this is just redirecting, finding a scapegoat, trying to explain why these other countries were unprepared and did not do the job. They did not protect their people. They put economics above them. And I think as an ordinary citizen, when you know that your country's doing that, you don't feel more safe.
Dr. Tan, your thoughts on this? Do you think that China has done its job to carry out this principle of putting people and life first?
I think that in principle it has. If we look at the results of your mass vaccination campaign, they are so impressive. A country of 1.4 billion people, about the same population as the entire continent of Africa, and yet you've managed to achieve greater than or about 90% complete vaccination rate, so first completing the primary series. This is very impressive. Now, if I may comment, though, about the zero dynamic COVID and lockdowns, Right Honorable Helen Clark, the former Prime Minister of New Zealand, has also been very vocally critical of New Zealand's response. So this is not just West against East. It's about how can we do better next time. And so any country that needs to go into lockdown in the future, I think this could be seen as a failure. We need to find ways of preparing for a pandemic so we do not go into lockdown and we can adequately prepare and prevent pandemics from happening in the first place.
Certainly there are things that we need to reflect on during the past 3 years so that we can be better prepared for the next time in the event of another pandemic. Now, the Western media was quick to criticize Wuhan's lockdown. Some public health experts argue that the lockdown would have little effect on the course of the pandemic. And a study by scientists from institutions including Harvard and Oxford, published in Science magazine in March 2020, found that without the Wuhan lockdown, 750,000 infections would have been reported by day 50 outside the city. In reality, the number was capped at under 30,000. In other words, there were 96% fewer cases in China due in large part to the early lockdown. So, Einar, how are you looking at this?
Well, I mean, I can't believe that people would actually say this. So
what could
you don't
happen
need to
without
contain
the lockdown?
Well, I mean, it's just nuts. I mean, this idea that you did the wrong things by doing the right things. I mean, it's saying black is white, white is black. I mean, it's nonsense. And people have to see through the politics here. And as I keep repeating, this is simply an attempt to cover up incompetency in other governments. They just want to say, oh, you know, you should have just let it go. If China had let it go, can you imagine what the headlines would have been? Oh, China doesn't care. It lets the virus spread, and now it's spreading to other places. They said that anyways, despite the drastic actions that China took to save lives. So China is in a no-win situation when it comes to the politics. But the facts speak for themselves.
And Dr. Tan earlier mentioned the vaccination campaign here in China. If you look at the vaccination rate among senior citizens at the age of over 60, that rate stands at 96%. That's pretty remarkable, isn't it, Einar?
Well, it was, but you still had groups, especially over 80, they kind of shut themselves in, and they said, well, I need a virus? I don't go out very much, and there were concerns. And there was so much disinformation being spread on the social media. So it was being amplified. Where were the responsible governments in trying to shut this down and to prevent people from being afraid? And that's the real tragedy here. China did what it had to do. Were there mistakes made? Of course. China isn't perfect, but every time there was a problem, China sat down and tried to figure it out. And this is the most that you can expect from your government, from the people who are entrusted with your safety.
Yeah, they are constantly modifying and adjusting and optimizing their policies. I mean, people's voices are heard. And adjustments were made to it. We're not perfect. It's a learning curve, but we are trying to make better next time.
Absolutely. What else can you expect if you're doing your best? But at no time were the political considerations allowed to take the uppermost hand. Nor did people say, well, if a bunch of people die, but the economy's good, that's good for things. Who's it good for? It's good for the wealthy people who, during this pandemic period, increased their wealth by trillions of dollars at the expense of people. Where was the government? Where were these other governments then? Why aren't they talking about that? Instead, it's always, oh, China did something wrong. What?
And Dr. Tan, a WHO report predicted that in 2027, the life expectancy in China would overtake that of the United States. But this COVID-19 process accelerated that. I suppose this wouldn't be a surprise to you. The impact of a country's COVID response on its people's life expectancy is huge, isn't it?
Yes, absolutely. If we look at a global scale, the life expectancy did go down by 1.7 years because of the pandemic. This is between 2019 and 2021. There have been some countries where the life expectancy even went down by more than 4 years. That would be the Russian Federation and Mexico. So absolutely, the pandemic has impacted healthcare outcomes, and the lifespans of people around the world. In terms of Hong Kong and Macau's special administrative regions, they actually fared much better. New Zealand, Australia, also their life expectancy went up between 2019 and 2021 by 1.2 years. So yes, how you respond to a pandemic can have very lasting impacts on the health of your population.
Yeah, I think it's fair to say that without the lockdowns or the dynamic zero COVID policy, a lot more people could have get infected, a lot more people could have died, and this is not being dramatic. Stay with me. You're now watching our special program, China's COVID Decisions. We'll be right back.
There are now confirmed instances of human-to-human transmission.
There's no question that China's bold approach
这个疾病的传染性还是蛮高的。
疫苗的充分的注射，
上楼做核酸，
以最小的社会成本获得最大的防护成效。
Welcome back to our special coverage. The pandemic cast a shadow over the world economy, and that included China. And earlier, my colleague Zhong Shi gathered some economic data about China over the past 3 years. Take a look.
In 2020, China's GDP grew by 2.3% year-on-year, the only major economy in the world that showed positive economic growth. In 2021, China's GDP grew by 8.1% over the previous year, ranking the second in the world, accounting for more than 18% of the global economy. In 2022, China's gross domestic product hit almost $18 trillion as it posted a 3% year-on-year expansion. Moreover, the total import and export value of China's goods trade in 2020 was almost $5 trillion, an increase of 1.9% over the previous year. In 2021, China's total foreign trade of goods expanded 21.4% year-on-year to $6 trillion. In 2022, China's annual foreign trade exceeded about $6 trillion, with annual import and export figures reaching new heights.
So, Einar, China was the first major economy to register positive growth emerging from the pandemic, and that is strongly related to its handling of COVID-19, isn't it?
Well, yeah, I mean, you can't have one with the other, without the other. If China had been paralyzed by and its medical system overwhelmed, people sick, they couldn't operate the factories. Yes, there were lockdowns. It did interfere with things, but it saved lives. As a government, you have to weigh. It's not you ignore the economics, but you have to take care of the people first and still grow the economy. China was really the only nation large of its size that was able to do this. Even countries that were half the size did not fare as well.
Yeah, it is a pretty strong showing when it's compared with the rest of the world. Now, some also criticize that China's COVID policy have disrupted global supply chain. What do you think?
Well, you know, that's interesting. So the idea is that a lot of people in China could die as long as other people could get their goods. I don't understand the logic of that. If the Chinese economy, if the Chinese government had said, listen, you know, we want to make sure that somebody gets their washing machine, so about 500,000 people are going to die. It doesn't even make sense at first blush. It's just trying to make China the villain in all of this stuff when China's actually done the best job. And we're going to see that. Later this year, it's going to become crystal clear exactly how well China did. And I'm waiting for the negative spin that comes out after that.
Let's take a look at the other side of the picture. Since the beginning of 2023, the latest economic data shows significant rebounds in transportation and consumption on a year-on-year basis, reflecting the vitality of China's economic recovery. China's industrial output increased by 2.4% in the first 2 months of 2023. Factory activity kept pace with bustling consumer demand, but posting solid growth rates. And China's retail sales jumped by 3.5%, reversing an annual loss of 1.8% last December. December. The country's ticket sales platform Maoyan showed cinema box office receipts hitting 6.7 billion yuan, and that's about $1 trillion by the end of the Spring Festival holiday in February. Domestic films contributed to most of the revenue. The rebound in travel within China was reflected in over 4.7 billion passenger trips during the 40-day Spring Festival travel rush this year. So, Einar, some of the international economic institutions, including the World Bank, has raised their expectations of China's economic outlook. They say that China's 5% growth rate target is being conservative. What do you think?
Well, there are significant headwinds. I mean, you start to see global demand, and there are real problems there, especially in the developed world. The United States is not faring well. Europe is really bad. Great Britain looks like it's falling off the precipice. And these were centers of global demand. So that will have some effect. So the question is, how do you do it? China has a dual circulation policy as strategy. On one side, they're depending on domestic consumption to drive a lot of the economy and also attract a lot of outside investment. Now, is that working? There's still a lot of work to be done in terms of resurrecting the small, medium-sized business entities that create 90% of new jobs, 80% of existing employments. They were hit hard during the pandemic. They did make sacrifices. But on the other side, when you start looking at investment coming in, the numbers are stratospheric. They're month to month, all the way along. China has been increasing the amount of foreign direct investment into China. Why? Because it is stable, because they do have a plan, and they have responses that the business community obviously believes are sustainable going into the future. Where do you want to put your money? In a country that is having negative growth or one that has positive growth? In terms of being conservative, maybe it is, but at this juncture, when you don't know, there's no point just saying, oh yes, it's going to be really high. Expectations have to be controlled.
Yeah, and Dr. Chen, final remarks goes to you from a global public health response perspective. What kind of challenges could emerge in the post-pandemic era, and how should we better prepare for it?
Right. Well, I'd like to start by saying we're not in a post-pandemic era. We're in a pre-pandemic era. In other words, after one pandemic is over, you don't go down to level 0. There is, we don't go to a state where there's no more threat. The time that we are in is to prepare for the next pandemic, because we know that it's not a matter of if or whether there will be another pandemic. It's a question of
going to be
when
another
and will
pandemic,
we be ready.
for sure.
And so being ready for the next pandemic is the kind of attitude that we need to take right now.
Good, good. Well said. Thank you very much. I'm afraid that's all the time we have for now. We're going to leave it there. Thank you very much, Dr. Alice Tan joining me from Seoul and Einar Tengen joining us here in the studio. Thank you for the thought-provoking discussion. And that's going to do it for our special program on China's decisions during the COVID-19 pandemic over the past 3 years. Thank you very much to our guests and to you, our viewers, for joining us. Stay tuned with CGTN for more news coming ahead, and bye for now.